Good evening. I'm Michelle Leifer, the director of the USDAN Institute for Animal Health Education at the Schwarzman Animal Medical Center. I hope everyone is keeping cool. I know it's been a rough few days, but thank you for joining us for this webinar tonight. We're going to be talking about minimally invasive surgery in pets with Dr. Daniel Spector. And I'm joined tonight by my new colleague, Valeria Menendez, who just started this week as our new education and events coordinator. We're so happy to have her on the team. And starting right out with the first webinar, I'm going to hand it over to her for a moment just to say a quick hello.
Hi everyone, I'm Valeria. I'm really happy to be part of the team here now, and I'm looking forward to where we go from here on. Thank you.
Thank you. And I look forward to all of you getting to know her over the coming weeks and months. So we are, again, thrilled to have you here. And just a quick reminder, though, I want to point out that this webinar is for informational and educational purposes only. It's not a substitute for professional veterinary advice, diagnosis, or treatment. If you have concerns about your pet's health, please consult your veterinarian. Tonight's session is being recorded, and we'll send out a link tomorrow in case you miss anything or would like to share it with a friend. We'll be taking questions via the chat box at the end of the presentation, and we'll get to as many as we can. Just as a reminder, we're not able to answer questions that are too specific to an individual pet, since we can't provide medical advice without a full veterinary exam. But if you have questions about your pet's health, we encourage you to speak with your veterinarian. I just want to take a quick moment to let everyone know about our next webinar, which is Anesthesia and Your Pet, Easing Fear, Explaining the Facts with Dr. Andrea Looney, Senior Veterinarian and Specialist in Anesthesia and Analgesia at AMC. And that will be on Thursday, July 31st at 6 p.m. You can find details and register at amcny.org/events. And we'll also have that information and the link in our newsletter that goes out tomorrow evening. And now it is an honor to introduce tonight's speaker. Dr. Daniel Spector is a board-certified veterinary surgeon and head of Surgical Service 2 here at the Schwarzman Animal Medical Center. After graduating from Tufts University School of Veterinary Medicine in 2006, he completed his internship at Angel Animal Medical Center in Boston and his surgical residency right here at AMC. He went on to lead surgical services in Chicago and New York before returning to AMC in 2015. Today, he leads the Denise and Michael Callan Institute for Surgical Care's new Minimally Invasive Surgery Center, helping to shape the future of surgical care for companion animals. We are so grateful to have him here with us this evening. Please join me in welcoming Dr. Daniel Spector.
Okay, thank you, Michelle. Thank you, everyone, for being here. I'm just giving me a second while I share my screen, hopefully.
Looks good.
Everyone can see, and my laser pointer is up there.
It's working. Yep, perfect.
Excellent. Well, I very much appreciate everyone spending a little bit of time with me this evening. Like Michelle said, I'm Dan Spector. I'm one of the surgeons here, and also director of the surgical residency program as well. And I am very excited and grateful to have the opportunity to talk about what minimally invasive surgery is in veterinary medicine. It's a huge aspect of our surgical practice here and in our residency program as well. I do want to start with a disclaimer. As Michelle said, and I have said, I am a surgeon. This is a surgical talk. So there will be some surgery and surgical images, videos, etc. moving forward. I will do my best to make sure to prep people beforehand so that if you need to look away, you certainly can do that, and I'll let you know when you can come back. We have a frozen screen. Give me 1 second here. There we go. Okay. So what I'd love for everyone to walk away from this evening after we've had this conversation is, what is minimally invasive surgery? We hear about it we talk about it, but I really want to discuss what it actually is, how it differs from open or traditional surgery, what the benefits of it are. Anytime we have any kind of new technology or anything like that, we need to know why we're doing it and what we're looking to achieve with that. And as we talk through this evening, we're going to talk a lot about the progression, where we've come, and some of where we're looking to go in the future. And to understand that, and frankly, I find interesting, I do think it's important to think about and to understand the history of where we've come from to help shape where we're going. Unfortunately, you'll have to bear with me. This is very equipment heavy surgery. And so, what I will do is briefly, but I'm going to explain some of the equipment that is required for this type of an operation, so that you can better understand what we're talking about, what we're doing, and how all of this ultimately helps your pets, cats and dogs, have a better surgical experience. We will talk about specific surgical procedures, both laparoscopic as well as thoracoscopic, and we're going to come back to those two words in a minute or two here. And then ultimately, how do we decide? Just because we can do a type of operation, should we? And how do we decide if a minimally invasive approach is best and is right for your pet? So, what is minimally invasive surgery? Minimally invasive surgery involves small incisions to perform our operation. So, typically, incisions between 3 and 10 millimeters in size. And I think, yep, for people who are not as familiar with the metric system, down here we have a ruler. The green line here is about 3 millimeters. The red line is about 5 millimeters. And then this is an inch. So just to get an idea of the size incision, so we're using small incisions and we're placing this scope through those small incisions with a high definition camera, brilliant light to be able to see what we're doing, and then magnification, which really helps our precision instrumentation perform these types of surgeries. And so that is what minimally invasive surgery is. It differs honestly only from traditional or open surgery in that the incisions are much smaller. Everything that's happening on the inside is still the same. We still remove the tumor. We still take the same biopsy samples. It's just the way in which we do it through smaller incisions, which ultimately results in less internal manipulation. And that means there's less retraction, there's less movement, pulling, tugging, and that is what helps these patients, cats, dogs, people, be more comfortable on the other side of surgery in their recovery. And we're also able to increase our degree and level of precision because of the magnification. And so what we're looking at right here to get a sense of what we're talking about, these two dogs right here are lying on their backs, and they're both about to have their gallbladder removed. So the same surgery is going to happen in both of them. And just for reference, this arced line right here is the diaphragm. So here's his chest, here's his belly, same thing over here. Now, one of the main differences is this dog is going to have an open or traditional surgery where the incision is essentially the length of their belly so that we can see everything that we're doing. This dog will have the same procedure, but with 4 small incisions. But what's really important to keep in mind is it's not just the size of the incisions that help them be more comfortable, because once we make those incisions, the dog on the left here then has a retractor placed to be able to hold open his abdomen so that at least these 2 hands, but realistically 4 to 6 hands can be in the abdomen to be able to hold intestines out of the way, to be able to allow the surgeons and allow us to safely approach and get to the areas that we need to treat. In this instance, the removal of the gallbladder. Conversely, this dog over here, same operation, But through these small incisions, we're going to place a camera, small, much smaller instruments to be able to do the exact same procedure. So smaller incisions, less manipulation results in less postoperative pain. And the way that I help describe the increased precision, how is it that we get a better view when we're doing it minimally invasively through a small incision in a small camera, as opposed to being in there with our eyes and hands? And I use the analogy, if you're looking into this cave, you can stand outside with a flashlight and you can get a sense of the rough surface, you can get a sense of the moss on the edge here. But if you really want to get close and you really want to see an insect or a bug up close and personal, you're going to put on a headlight and you're going to crawl directly into that cave. And that's exactly what minimally invasive surgery allows us to do. We essentially put our entire bodies inside of the area so that we can manipulate, we can perform the operation with much greater precision, magnification, and that helps make it a much safer procedure. Now, I mentioned before that we would come back to the words thoracoscopy, laparoscopy. And so what does all that mean? These are just different areas where the surgery is performed. So thoracoscopy or thoracoscopic surgery refers to minimally invasive surgery within the chest. Laparoscopy is minimally invasive surgery in the abdomen. And then arthroscopy is just minimally invasive surgery in any joint. Now, that is an evening webinar in and of itself. So we are not going to talk anything about arthroscopy this evening. We are going to focus tonight on the topics and different types of procedures of thoracoscopic as well as laparoscopic surgery. Ultimately, the point of all of this, the benefit of this, there's smaller incisions, there's less internal manipulation, so these animals have a shorter recovery time. Now, it's important to stop here and make sure I'm using the words correctly. It is a shorter recovery period. It is not shorter healing time. Skin incisions or the incisions still take a similar amount of time to heal, but they have a shorter time in the hospital because they're more comfortable. They get to be on oral, less strong, less intense narcotic medications sooner. So they get to leave the hospital and get home to you sooner, and that's better for everybody. Most of these surgeries are actually associated with lower complication rates than their open counterparts. And like I mentioned a minute or two ago, we get much better visualization with the degree and level of magnification, light, and how close we can get to what we're actually doing with minimally invasive surgery. This is truly nothing new. Minimally invasive surgery, while the way in which we do it now is highly technologically advanced, minimally invasive surgery as we know it really started in the mid 1800s. And so in 1853, a physician named Antoine Desormeaux is really credited as being the father of modern minimally invasive surgery, where he used this system of lenses and mirrors to be able to look in the anus, the urogenital tract, and the back of the throat of people. But if you notice the year, there was no light bulbs at that point, and so candles were actually the source of light that he used. And so, as you would imagine, people got burned. It wasn't really widely used because it was just cumbersome and frankly dangerous. And it wasn't until the late 1800s when Maximilian Nietzsche actually used platinum wires to be able to have an electric light source, to be able to use this cystoscope. And that is minimally invasive surgery within the bladder. So to be able to put a camera in a person's bladder. This was cumbersome. Excuse me, this is cumbersome. It is quite a cooling system that is required. And it wasn't until the late 1800s, after Thomas Edison helped provide us with an replicable electric light bulb, that minimally invasive surgery could actually start to progress with a functional light source. And just to give a little perspective, because I always think it's interesting, 1853, when minimally invasive surgery is happening, when it's really starting. What else is happening in the world as we are starting this new avenue of surgery? The first potato chip is ever invented, prepared, cooked in Saratoga in New York. Levi Strauss Company is started, and Washington State becomes a state. So early in this time, this is when minimally invasive surgery is starting. And then fast forward into the early 70s. What's happening now is instead of having to look through that tiny little instrument with your eyeball, now there are monitors and there are video recordings with cameras, video cameras. And so we're able to project these images on a screen, which allows us to do more because we have free hands. And then in 1980, the first laparoscopic appendectomy, removal of the appendix, and 1985, the first laparoscopic cholecystectomy, or the first laparoscopic gallbladder removal, was performed by Erich Muir, who is a German physician. Now, this is currently standard of care in people in most instances. However, he did not get the pleasure of being widely accepted. So the acceptance of minimally invasive surgery in people was very, very slow. In fact, it was outwardly downplayed, and they tried to stop it because most people did not understand the benefits of it then. As we progressed into the 1990s, they developed metal clips that could close blood vessels. And that really allowed surgeons to start doing much more advanced procedures in the early 1990s. In veterinary medicine, we had a similar trajectory. However, we had the benefit of not having any roadblocks. This was already widely accepted, so it did not take much convincing of the benefits of this. So really in the early 70s, that's when in a research setting, the first laparoscopic spays, vasectomies were performed. And really, right here at the AMC at the time, now Schwarzman AMC, the pioneering of endoscopy. So really the first uses of minimally invasive procedures, diagnostic procedures, were performed right here. And so minimally invasive surgery has been part of AMC since the beginnings within veterinary medicine. And then really in the early 2000s, that's when it really took off with our ability to do much more advanced procedures, as well as the acceptance in the veterinary community and doing things like this to expose and show the benefits to all of us where we can help provide an easier surgical recovery in our veterinary patients. So much so that actually about 10 years ago or so, the American College of Veterinary Surgeons, the college that board certifies us, has made minimally invasive surgery an actual requirement to be able to complete and finish your surgical residency. Since we have had the ability, the willingness, and the desire to do a large amount of minimally invasive surgery, this has been well established within our program. So that's how we got to where we are now. Unfortunately, like I mentioned before, I will ask you to bear with me for a couple minutes here because I am going to talk a little bit of the technology that we use to be able to perform these surgeries. And so the equipment that we need to be able to do these surgeries, we need a camera, we need a telescope, which is the actual scope that we put into the chest or the abdomen. And again, we need to be able to see. So we have a light source, we project it on a monitor, and then we have high precision instruments to allow us to do most surgical procedures that we can do open. Many we can do minimally invasively because of the instruments that we have to be able to remove, manipulate, and stop bleeding. Insufflation is a big deal with laparoscopy. We're going to come back to that one in just a little bit. So first, like I said, our camera, a 4K or high definition camera. This projects collects a very, very detailed, clear, precise image, but we won't be able to see that without a good light source. And really, you can follow the progression of headlights in cars with our progression in surgery, starting with halogen bulbs, xenon bulbs, and ultimately now LED lights, because that provides the most bright whites and the most clear picture. And this is an analogy. This is a road illuminated with car headlights, xenon headlights, and you can see, you'd be able to drive safely, but I think all of us would agree that the LEDs provide a much clearer, much safer road to travel. And so there is a dramatic increase as we use higher level technology. And then a camera and image is really as good as the monitor or screen that it's projected on. So if you look at a standard definition television or monitor, you can really see this beautiful sunrise over here over the harbor, but in a ultra high def monitor, the spectrum of colors that can be projected is dramatically enhanced. And so this is the difference as we progress and as we are fortunate enough here to have the highest levels and the most precise cameras, lights, and monitors to be able to perform these types of surgeries. What is insufflation? Insufflation allows us to be able to work within the abdomen. It allows us to be able to safely place our instruments, see what we're doing, and to be able to safely complete the surgery. Now, what does this mean? I use the analogy, if you try to do surgery without insufflation, it's sort of like climbing into a tent, trying to read a book, and the tent has no frame. It hasn't been put together. It's going to be really difficult to read that book. So when we use insufflation, what that means is we instill flow carbon dioxide into the abdomen so that we can distend the abdomen so that we can more safely be able to work. So that you put a frame in that tent and you can sit safely and you can read and you can perform that surgery. And so we use, excuse me, we use carbon dioxide because it is very safe. It is not flammable, and is the best, as of right now, method to be able to expand the abdomen and the abdominal wall so that we can safely perform that surgery. That requires an instrument here, which regulates. We very closely both regulate, monitor, and set the amount of carbon dioxide that we put in. So we use the lowest amount that we possibly can to be able to safely perform that surgery. And the ports that we use that actually go through those incisions are either 5 millimeters. I'm going to put my measuring stick up here again. So 5 millimeters. These have valves in them, so we're able to put our instruments in and out without losing that distension, no gas escape. So we're able to perform that procedure through these ports. Our instruments and our cameras go right through the middle of these, either 5 millimeters, or this is going to be a recurring theme that I continue to talk about, is the size of the animal doesn't necessarily prevent them from being able to have minimally invasive surgery. This right here are our pediatric instruments or ports. These are 3 millimeters or 3.5 millimeters in diameter. They fit instruments that are 3 millimeters. So we can do minimally invasive surgery on small dogs and cats as well. And then, without completely boring everybody, the instruments that we have allow us to do any type of operation that we are trying to do, whether it's sampling, stapling, hemostasis, or stopping of bleeding. So it allows us to do basically anything that we're intending to. So now we've completed, we know what the instruments are, we know where we've come from, but what are we doing? What do we do? And so some of the more common types of minimally invasive surgeries that we do here Starting in the chest or thoracoscopic procedures, lung tumor removal. We're able to remove, and we're going to come back to this a little bit later on this evening, but we can remove many different lung tumors minimally invasively. Thoracic duct ligation, which is a treatment for a condition called chylothorax, that is something that we do minimally invasively. A pericardectomy is when we remove the sac that surrounds the heart. There's a number of reasons that that may be required or that may be recommended. Another type of procedure that we can do minimally invasively, as are some congenital abnormalities that can make it hard for puppies to eat normally. All of these are some of our more common types of minimally invasive surgery that we perform here in the chest. Most commonly in the abdomen are spaying, crypt orchid testicle removal or undescended testicle removal that are in the abdomen. Gastropexy or stomach tacking is probably the most common procedure that I perform here, and that's something that we're going to come back to in just a little bit here because I think that that's really important. Gallbladder removals, tumor removals, all of these are some of the more common types of minimally invasive surgeries that we perform here at AMC. So we will start this evening in the belly, laparoscopic surgery or laparoscopy. Fair warning, there are surgical pictures coming up, so if you need to look away for a few minutes, you can certainly do that, but they are coming. So how do we do this? So for perspective, this is a dog lying on his back. His head is way over here. His tail is way down here. And we're making you can see hands, so you get a sense of the size. We're making a small incision in the abdomen so that we can then place these ports right here directly into those incisions. And this is where we hook up that insufflation and we flow in gas, kind of like carbon dioxide, kind of like you would blow up a balloon. Once we do that and they're insufflated, now we have a camera going through there. We have insufflation coming in there. And now we are looking from the inside and we can much more safely place other ports to be able to perform the operation while watching safely from the inside to make sure that everything is placed where we want it and not damaging anything on the inside. And again, like I said, size of the patient is a little bit less important. Again, size of fingers to give relative size. These are those 3.5 mm ports. So this is a very small dog having laparoscopic surgery. So we're able to do it in a large number of sizes of animals. Okay, pictures are over for a second or two here, but they will be back. I'm trying to give as much warning as I can. So like I said, the most common procedures that I do, that we do here, is a laparoscopic spay. What does that look like? We're looking inside of a dog's abdomen here. We are looking to the side. This right here is holding an ovary right here. And this device right here is a cautery type device. And what we're going to do is come right across so that there is essentially no bleeding and remove this ovary very safely in a nearly bloodless operation. Similar, this is an undescended testicle. Now, if we were to do this as an open or traditional surgery, this would require an incision way back at the very back of the dog's belly, abdomen. Those notoriously develop a lot of bruising and a lot of swelling. So we can avoid all of that by using much smaller incisions to perform the same procedure. So almost exclusively, I will remove these when they're in the abdomen. I will remove these minimally invasively or laparoscopically. A lot of people recently have been talking about vasectomies as a means for sterilization of male dogs. That, especially as Michelle said, that is a very much a conversation to have with your surgeon, with your veterinarian, but something also that I perform minimally invasively. So using that same cautery type device to be able to perform the procedure. the gastropexy or the stomach tacking procedure. This is looking, and this is the stomach right here, and this is it tacked to the side of the body wall. And like I said before, this is a really, I think, really important procedure. And so I'm going to go through this in greater detail a little bit later on this evening. But one of the most common minimally invasive surgeries that we do here, as well as liver biopsies. We're actually doing them today as well. Anytime there is a chronic or ongoing disease of the liver and the primary care vet or the internal medicine specialist wants more specific diagnoses, we can go in minimally invasively and get all the samples that are needed. So these are some of the most common minimally invasive surgeries that we perform. And again, smaller incisions, multiple procedures can be combined. For example, a spay and a gastropexy or the stomach tacking is incredibly common, or neutering and the stomach tacking, incredibly common to do at the same time. It doesn't change time in the hospital, and it doesn't change the fact that these are now outpatient procedures. Dogs get to go home the same day. Less surgical manipulation, smaller incisions, less pain. All these dogs are having the same procedure, open, different types of minimally invasive. So much more comfortable, home to their families much sooner. And it's not just us feeling that this is a better procedure, this is a more comfortable procedure. There are a number of research studies out there, this one specifically now quite old, showing the benefits of a laparoscopic spay over a traditional spay. Shorter recovery time, meaning time in the hospital, not healing, more comfortable recovery, and even when combining with the addition of the gastropexy or the stomach tacking procedure. And that is what I want to talk about now. Like I said, this is probably the most common minimally invasive surgery that I or any of us here perform. So I do think it warrants a couple of minutes of talking about what it is and why we do it. So the stomach tacking procedure is technically called a laparoscopic prophylactic gastropexy, which is certainly a mouthful, but ultimately what it does is it anchors the stomach to do everything we can possibly do to prevent a gastric dilatation and volvulus, a GDV, a stomach twisting. That is a rapidly life-threatening emergency that requires emergency surgery as quickly as possible. Even in the successful cases, it takes several days of recovery in the ICU, really close monitoring and treatment with the critical care team as well. And so what that is, for perspective, a dog lying on its back, food comes down the esophagus down here, enters the stomach, goes through the stomach and out into the intestines. So what happens with a GDV, a stomach twisting, is this part of the stomach, essentially the exit valve of the stomach. We don't know exactly why it happens, but it moves, it twists and rotates to the other side. And so we can see that it turns, it comes over here, and then it twists, and it can rapidly cut off the blood supply to the stomach, which is why it is so rapidly life-threatening. And so what we do is we take this area of the stomach and we attach it to the inside of the body wall. We create an anchor so that it cannot do that. And this is what it looks like on the inside. Surgical video upcoming, preparation. So for perspective, the camera is towards the back of the abdomen. It's just behind the umbilicus or belly button, which animals do have. Typically, you don't see it until we've shaved their fur, but we put our camera back there and we are looking forward towards the chest, towards the diaphragm, with the dog on their back. And what I'm doing here is I'm placing a stitch in the stomach so that I can hold the stomach exactly where I want to be, exactly where I want it to be, so that I can perform the procedure. So instead of making bigger incisions, I place the suture or the stitch right there. And what we're going to do is we're going to pass this back outside of the belly so that we can temporarily hold it here while I use this cautery type device to make a small incision just on the outside here of the stomach. It doesn't go to the inside. It makes an incision or a wound essentially on the outside of the stomach. And I use cautery because it prevents bleeding. And so I make a similar or analogous wound on the lining of the belly or on the lining of the abdominal wall. So now I have two separate wounds, and I use this special type of stitch material or suture material all on the inside to then suture or sew that wound up against this wound so that in addition to the suture material or the stitches, the body will heal as it normally should, so that over the 6 or so months that it takes for this suture material to dissolve and go away, within a couple weeks, this will heal permanently to the side of the body wall, ultimately anchoring the stomach up here as close to preventing the twisting as we can possibly get in medicine and surgery, meaning that nothing is 100%, but this can exponentially reduce the risk of that stomach twisting procedure. And so we suture that all the way up. And then this dog gets to go home the same day. And this is ultimately what it looks like at the very end, similar to the photo you saw a little bit ago. How do we decide who would benefit from this? And this, again, is a conversation with your veterinarian, with your surgeon. But in general, we see GDVs or the stomach twisting in large, deep-chested breeds. There is a genetic predisposition and a genetic link in Great Danes, but we see this in standard poodles, shepherds, Labrador retrievers, golden retrievers. So for me, because there are minimal complications, this is an outpatient procedure. They are very comfortable, get to go home on oral pain medications the same day, and we can exponentially reduce their risk of a life-threatening emergency. I think this is a very important procedure to consider for our large breed and deep-chested dogs, especially those that are very energetic, those that are very anxious. So over time, the progression is a traditional surgery to have this procedure performed. These are different dogs, different size dogs. So for perspective, the diaphragm is right here. So you can see this dog has an incision the length of his abdomen. This is for a different surgery, but this would be the incision, the length of his abdomen. About 10 or 12 years ago or so, we progressed and we made a smaller incision, but still a long incision. This is, you can see a hand there. This is still about a 5-inch incision or so. Now, this is a St. Bernard, and you can see there's one incision, 5 millimeter incision here, a 5 millimeter incision here, and a 5 millimeter incision here. 3 small incisions to perform the same surgery as this dog, except he got to go home the same day. So I think a very important minimally invasive option that we have. Another benefit or another operation that we do commonly is called a percutaneous cystolithotomy. Another mouthful, we call it a PCCL. Ultimately, it is a minimally invasive or less invasive way to remove bladder stones. Still incisions, but smaller. Again, better visualization. We can be much more certain that we've removed all of the stones because we are in the bladder, essentially, magnified, and so we can see stones that wouldn't even show up on an X-ray. And so because we're more delicate to the lining of the bladder, these dogs and cats get to go home for the most part, as long as they are otherwise doing well and healthy, get to go home the same day. And so we're also able to remove stones that would be otherwise extremely difficult to remove and would otherwise need a much more invasive procedure. So you can see this is a very large white stone in this dog's bladder. These videos here are not this dog, but for example, this excuse me, this right here is a stone lodged in a dog's urethra. This stone was not going to move. So if we weren't able to get a small camera all the way down his urethra and ultimately a basket, just a millimeter or two in diameter there, down his urethra to be able to remove this stone successfully, this dog would have needed a much more invasive surgery into his urethra that can be fraught with complications. And similarly over here, this bladder stone, we're not going in with a more, excuse me, with a more invasive instrument that can be traumatic to the lining of the bladder. We're going in with a camera. We can very clearly see this stone, and we're going to go in with a basket. We're not damaging, you see right there, we're not damaging, we're not impacting, we're not even really touching the lining of the bladder wall. And we can grab this stone with a basket and be able to pull it out. This dog does not need a full night on IV fluids. This dog gets to go home the same day. So we're able to remove much less traumatically some stones that can be extremely problematic to remove. And so without belaboring, this is one of our 3 minimally invasive operating suites upstairs in the operating rooms. What I'm most proud about is every time I give a minimally invasive talk, this list right here continues to expand. So we're continuing to expand what we can offer, what we do offer minimally invasively, from gallbladder removals to certain types of hernias repairs. So there is a lot of minimally invasive options for animals, dogs and cats, that we can do here that aren't offered anywhere else in the city. Moving up front, moving into the chest, that presents some slightly different challenges for visualization, which is actually the exact opposite of minimally invasive surgery in the abdomen. So remember, in the abdomen, everything is collapsed, and we have to use insufflation to expand it so that we can safely work. Well, in the chest, there's our rib cage that keeps everything elevated, but lungs take up a large area of the chest cavity. And so to be able to create a safe working environment, we work very closely with our anesthesia colleagues to be able to essentially collapse part of the lungs to be able to have a safe space to work. So what that means, we're looking at a windpipe right here. This is the anesthesia tube. Through that, we place a little balloon in one of the airways and blow it up so that we do not put any air, any oxygen into that one area. We're able to perform anesthesia through the rest. What that ultimately looks like, we place that, we're able to collapse this lung slightly, and that gives us this sort of much more pale pink area as safe working areas to be able to do whatever operation we need to do in the chest, as opposed to having the lungs expanding, getting in our way, and providing or preventing safe working corridors. So the most common minimally invasive surgery that we do in the chest would be lung tumor removal. Typically, that would be a dog lying on its side with our camera and instruments going in through the side, most commonly for lung tumors, but there are other reasons that we can remove areas of lung minimally invasively. Fair warning again, there is a surgical video coming up so that I can show you exactly what I mean and what I'm talking about. Here we go. So this is a partial, but this is a lung lobectomy in a dog. So we can see I'm about to take a picture looking at size. This right here is a small lung tumor in this dog. Now, normal lung is this really, really light peach colored, almost sponge looking areas. As we can continue to work through our small incisions, this really dark area, these are those collapsed lungs, and you can see that we're able to safely get our stapling equipment in so that we can perform the exact same lung tumor removal that we would do through a much bigger incision between the ribs with a lot of retraction, we can do the exact same procedure completely on the inside. The surgery itself is the exact same. Then we place the tumor, what we're removing, in what's called a specimen retrieval bag. What this does is it just prevents the tumor itself from touching the body wall on the way out, which can cause problems. And so with that, we're able to perform a minimally invasive partial lung lobectomy. And in some cases, these dogs and cats are able to go home the next day. And so who benefits most? It really depends on that individual pet, their overall health. So we will always start with our basics, our physical exam, our history. Diagnostics are really important, especially in determining who benefits most, especially with thoracoscopic or minimally invasive surgery in the chest. So blood work, are they otherwise healthy? Is this tumor over here? So this is a CAT scan in a dog. You can see the windpipe coming down. This is all lung here and here. The dog is lying on its back. You can see this tumor right here is way out towards the periphery. So we use a CAT scan as one of the most important determining factors in determining tests to be able to say, yes, this is a smaller tumor. This is way out at the periphery. I think this dog would most benefit from a minimally invasive approach. And again, the size of the patient is a bit less important, somewhat. This is a chest of a cat. Same thing, windpipe, airways, tumor, way out at the periphery. This is a cat who we were able to perform a minimally invasive lung lobectomy for this tumor and send that cat home comfortably the next day after a night in the ICU. So it really depends on each individual, a physical exam, evaluation of medical records, of diagnostic testing, and review of all of the scans to help better guide to be sure that we're making the best decisions. So again, our two dogs here are having a lung tumor removed, open or traditional incision, minimally invasive incisions. Already you can see the difference. But once the incisions are made, hands, retractors, this is where a lot of that discomfort comes from. Here, dramatically less so. The benefits, the rewards of minimally invasive surgery are exactly the same as what we see and what we expect in people. Patients recover much more comfortably. They need less time with strong pain medications, and that lets them go home sooner. And like I said, sometimes the next day with some chest procedures and some of the more advanced minimally invasive surgeries. Many of these surgeries, liver biopsies, spaying, are outpatient procedures. They get to go home the same day, and they can return to comfortable activities sooner, but they still need their incisions to heal. Like I mentioned, AMC, we have been there, and minimally invasive surgery has been a part of us since its inception in veterinary medicine. And the progress continues. And very briefly, one of the most exciting aspects that we have in our brand new surgical suites is near infrared imaging, or NIRF. Very briefly, what that is essentially it is just advanced optical imaging. What it does is it uses fluorescence, which is typically we inject or we give something called indocyanine green, or ICG. It's incredibly safe. We can give it a variety of ways very safely. What we do is, and how fluorescence works, unfortunately, just bear with me for a second here. You have a material, you cause excitement. So we aim a laser through our scope at it. It gets this material excited and it emits photons or light in a very bright way as we picture fluorescence. And so it allows us to see tumors that we couldn't otherwise see, it in margins that we couldn't otherwise see. It allows us to find draining, sentinel, important lymph nodes in cancer surgery. In this example, this is the chest of a dog. You can see the fluorescence turn on. This is a lymph vessel right here. This is that chylothorax procedure that we need to find this vessel and tie it off so no more lymph leaks out of it. You can see how dramatic and how much easier and safer we can see it with this fluorescence. So we are incredibly fortunate to be able to have this advanced imaging to be able to allow us to do even more advanced surgeries, importantly, safer surgeries and more successful surgeries in our patients. We can't talk about the advantages, though, without disadvantages. There is a learning curve. These are not necessarily intuitive procedures. Instead of being able to actually touch, you're getting used to a different type of response from your eyes and your hands with the instruments. But just in this past year alone, with 2 operating rooms and 3 surgeons doing minimally invasive surgery, we did about 130 to 140 minimally invasive cases. Now we have 3 fully functional, minimally invasive operating rooms with 7 surgeons who do minimally invasive surgery. So the amount of minimally invasive surgery that we do here continues to grow. Something that I'll always talk to families and owners about when I'm discussing minimally invasive surgery is the potential need to convert to an open or traditional surgery. And this is the same as in people as well. And this means that we need to forgo minimally invasive, or MIS, to progress to an open or traditional surgery. And that can happen if there's bleeding that we can only manage open or traditional, if there are unique anatomic variations within that individual that prevent our ability to perform the surgery, or based on the challenges or problems with the technology that we rely on to perform them, or specific to that disease, we're unable to progress, we will need to transition or convert to an open procedure. Now, the rates, the percentages, the chances that that happens depends highly on each individual surgery. So that is something that you would talk to your surgeon about. However, the benefits far outweigh the risks if and when it is appropriate for your pet. So the big question is it an option for my pet? So what I wanted to talk about tonight is give a broad description of all the different types of procedures that are amenable to a minimally invasive approach. However, like I said earlier, whether or not it is a true option for your specific pet really depends on our exams, our scans, and our diagnostics. And just like in people, earlier surgical treatment will always result in better outcomes. And so this fully supports serial wellness care with your primary care veterinarians, as well as the diagnostics that they recommend based on any changes that they find. Because if we can find something early, there is a much higher likelihood that a minimally invasive approach would be right for your cat or your dog. So we do it because we have the benefit and the luxury and the ability to use technology to be able to improve the patient experience. And I say the patient experience because it's not just the operation itself, though we can make a safer surgery for them, but it's an easier recovery, a more comfortable recovery, and a shorter hospitalization time. That gets animals, pets, back home to their families. That makes them much happier, much less anxious and nervous, and that certainly helps families as well. And it just continues to allow us to continually provide the highest level of care to all of our patients in the same exact way with the same equipment, the same technology that you or I would have if we went to the hospital ourselves. So we're very fortunate to be able to do that and to do it at the level that we provide here. And so with that, I want to thank everybody for spending your evening with me. And I am very happy to open up, and Michelle can help us, and Valeria can help us guide through any questions.
Thank you so much for giving us a closer look at this incredible area of veterinary medicine. We have just a few questions. Let's see. So we have my cat has kidney disease and had SUBs put in due to blocked ureters. Both standard surgeries required her to be treated for 2 weeks and several days in the hospital. Is there any possibility this procedure could be laparoscopic in the future?
I will say anything is possible. I am not one to limit the potentials for what could be possible in the future. As of right now, subs, SUBs, are not able to be placed minimally invasively. Those are open traditional type surgeries.
Okay, great. Let's see. Is MIS common for spays and neuters? I think you did talk about
It
that.
is the most common, a spay is the most common minimally invasive surgery that I do. Neuters, the only minimally invasive surgery option for neuters is for undescended testicles, the cryptorchid testicles that are in the abdomen. Otherwise, there isn't a minimally invasive option. We can get into the philosophical question of a vasectomy, which is technically a type of neuter that can be minimally invasive, but um, otherwise neutering is a traditional surgery.
Okay, great. I think that that's it. Any other questions? Anyone, please put them into the chat box. Otherwise, I think you gave a really comprehensive and very clear presentation. So thank you for that. And I think it really shows just, a powerful reminder of just how far veterinary medicine has come. Okay, of course, now we have a question. How common would you say MIS is in veterinary profession outside of your hospital? That's a good one.
Yeah, that's a very good question.
Hmm.
It is becoming more and more common, much more common. Like I mentioned, it is a requirement of all surgical residency programs. So most referral hospitals will provide minimally invasive surgery, but it is still progressing, is still developing. I'm extremely proud that many of our surgical residents go off when they finish to establish minimally invasive programs in the hospitals in which they work, which I'm incredibly proud of, and they get to do a lot of groundbreaking stuff. However, also there are general practitioners, primary care veterinarians that do offer some degree of minimally invasive surgery as well. Typically, those are spays, things like that. But there are some primary care veterinarians that will do some degree of minimally invasive surgery. We are just very fortunate to have the technology, certainly the experience, but the technology to be able to do the more advanced procedures.
Okay, great. No, I think this is a fair question, just the financial aspect of it. So financial constraint is a huge drawback, they're saying, or can be a barrier. Do you feel if MIS will be more accessible in general practice someday?
Yeah, that is such a good and really important
Hmm.
question. That is in part why I talked about and potentially bored you all dramatically with my description of the equipment, and that is part of it. This is unfortunately incredibly expensive equipment.
Hmm.
However, especially here, we do our very best to not let the procedure or finances dictate our medical recommendation. So in general, it's not a dramatic difference in cost. I certainly would hope and I would want, as it becomes much more common or as it becomes more common in general practice, if this is the question, that it would be more financially approachable because absolutely it is can be an expensive endeavor.
Yes, okay. Well, thank you again for this wonderful presentation. As a reminder to everyone, we will be sending this out tomorrow in case you missed anything or would like to share it with a friend. Thank you, Dr. Spector. This was really fascinating and I think a great reminder of just, again, how far everything veterinary medicine is progressing. Thank you, Valeria Menendez, for joining me on this first webinar. I look forward to working with you, and a very special thank you to all of you for joining us tonight. We hope to see you at our next webinar, which is July 31st at 6 p.m. On anesthesia. So we'll have the link to that so you can register in our newsletter that goes out tomorrow evening. And with that, we're going to say goodnight. Thank you again, everyone. And thank you, Dr. Spector, so much.
Thank you very much, everybody. Have a good night.